Welcome, everybody, to another wonderful episode of the Skincredible podcast. I'm Dr. Lisa Swanson. I am so excited for this episode, you guys. I hope you feel that level of excitement coming through the microphone and through the camera because we have a very special guest today. He is a pizza lover. He's a published author of dermatology articles and a book about pizza. He's the proud father of 2 human children and a doggie. He's an amazing dermatologist. He's an incredible human, and it is Dr. Peter Leo. Welcome, Peter Leo.
Thank you so much. Thanks for having me.
I'm so excited. I don't know if I've ever told you this, Peter, but I remember being at a pediatric dermatology conference maybe 10, 12 years ago, and you spoke at it. And it was the first time I had experienced the Peter Leo experience. I was just sitting in my chair, oh my gosh, I love this guy. He is so smart. He communicates so effectively. He is such an extraordinary speaker and dermatologist. You care about your patients and you educate so well. And I was like, I would like to be his friend. And so years later, I feel like you're my friend.
Well, right back at you. I have loved getting to know you, and I absolutely love when you speak. I feel like it's one of those times where I quiet everything, put my phone away, put the laptop closed, and I just listen because you are such a great storyteller, such a great educator, and you're just incredibly engaging. So right back at you. I'm sending that right back to you.
Oh, well, thank you so much, Peter Leo. And you have saved me so many times. You're part of my phone a friend circle. And I reach out to you when I'm stumped, and you always come through with the best suggestions. And you're dynamite, my friend. You're dynamite. Now, clearly, I know a lot about you, but our audience may or may not. Go ahead and tell the audience a little bit about who you are, what you do, and your love for pizza.
All right. Well, I'm a dermatologist in Chicago, and I've been in practice now almost 21 years, if you can believe it. And I mostly see atopic dermatitis. So my main focus is eczema, itchy skin conditions in adults and kids. And it's been quite a journey because there is just so much going on. As you know, we've been in the midst of this incredible transformation. I'm originally from Chicago suburbs. I grew up in a suburb, one of the northern suburbs, and then I was in Boston for a long time. I did medical school and residency in Boston, and then I actually stayed on as faculty at Beth Israel Hospital and Boston Children's Hospital for a few years. And then my son was born, so we came back to Chicago, and we've been here since. So I've kind of worked in a number of different environments, which has been really fun. I got to found this Chicago Integrative Eczema Center, which has been exciting, where I get to focus a little bit more on some of the integrative and alternative treatments for a lot of skin conditions. And I guess my claim to fame is that I studied acupuncture right after I finished residency. So that was great to become an acupuncturist. And I studied under Kiko Matsumoto and David Euler. They were fabulous teachers, and they're both people that I really respect and admire and learned a lot from. And then I guess my other claim to fame is the pizza stuff. And I love pizza. I grew up eating pizza. And then a few years ago, someone said, you should write a book about this.
Yeah.
And I thought, oh, that'd be crazy. I don't have time to do that. But then it just kept coming up and popping into my mind and haunting me over and over. So every time it would reemerge, I'd say, I better do something. So I started taking notes. And then the next thing you knew, we published the pizza prescription, and all of the proceeds go to the National Eczema Association. So that's been really fun.
I love it. And you did that with your brother, right? You and your brother are the pizza guys?
Yes. There's 3 Leo boys. So I'm the oldest. Then there's a middle brother who enjoys pizza, but it's not a pizza spaz like we are. And then the baby brother, who is also a pizza devotee. And he's really actually a very good cook. He loves to make pizza and is really talented. So the 3 of us all love it. But the 2 of us, youngest and oldest, put our heads together to taste pizzas from all over the country and all over the world and put that all in one very small book.
I love it. I love it. You need to come out to Boise, Idaho, because we have this place called the Wilder that has amazing pizza.
I would love it.
We got to bring you out. Yes. For the next episode that you're on the pod, we'll bring you out. We'll do it live. Another very important question, given that you live in Chicago. Have you ever been on the Bear?
No, I've never, but that is filmed literally outside our office. Like when they're filming, all the trucks are blocking our street. I mean, it's right there. And I walk past it every day because I take the L train to work.
Yeah. Yeah.
So every day I pass right by it, Mr.
Oh
Beef.
my gosh. I love it. I love it. That's so, so cool. How did you back in the day develop an interest in kind of integrative dermatology or integrative care? Where did that come from?
I've always been interested in fringe stuff. So, like when I was a little kid, I would just read all about the Loch Ness Monster and about telekinesis and all this kind of stuff, clairvoyance and Bigfoot. I love all that. So, when I got to medical school, I realized that some of those things, not specifically those things,
Yeah.
but the fringe would come up where people would say, what about acupuncture? What about Chinese medicine, herbs? What about Reiki? What do you know about it? And it was like, boy, we don't cover any of that. Like, we're not talking about any of this. So
Yeah.
I wanted to learn, and my patients were asking all the time. And I felt like it was interesting. So we created like an interest group, a student interest group, and we got some speakers, and that sort of started the whole thing. And then I started becoming known a little bit as the Fox Mulder person. Whenever there was a weird thing, be like, ask Peter, he might know about this. And,
The truth
sometimes
is out there.
exactly.
The truth is out there. Yeah.
Exactly. So and then little by little building. And then finally, when the opportunity came up to do something more formally, I took the acupuncture course for 1 year, and that was incredible.
That. And so does Nessie exist, the Loch Ness Monster?
It's a really good question. I think there's something going on in Loch
Yeah.
Ness, but it has really been tough. And they've had these incredible scientific crews, and they've done stuff with sonar and trying to figure it out, but we don't really know. They did a big genetic survey of Loch Ness a few years ago, and the biggest thing they found was interesting was a lot of eel. There's tons of eel DNA in there. So I don't know.
Yes. I saw an article about that, and that maybe Nessie was like an extraordinarily large eel or something.
It could be. It could
Yeah.
be.
Yeah. Yeah. Well, I could talk about that stuff all day. Aliens, like, can things be haunted? Do ghosts exist? Maybe we'll have to do another episode where we dive into that. But I wanted to talk about natural and integrative therapies, particularly for eczema, because I know that is something that basically anything I know about natural or integrative therapies, I've learned from you. You are my source for all of that information. And so instead of me trying to disseminate this knowledge, I was like, we got to bring Peter Leo on and have him tell the crowd because you're the expert. And so why do you think people are attracted to the idea of natural therapies? Do you have an idea of where that comes from?
I do. I think about this a lot, and I talk to a lot of patients. So I think there's kind of three big pieces that people bring up. The first one is that a lot of times our explanation for diseases aren't that satisfying. We'll sort of say, what causes acne? It's like, well, I don't know, stress and hormones and your pores get clogged. And what about my diet? Well, maybe not. There's some studies, like, it's very wishy-washy. But when you leave and go into alternative traditions, sometimes you'll get a much more, I don't know, mimetic or a more satisfying answer. It's like, okay, this is an imbalance in energy, or this is a gut problem. Like, it's much more, right? It's attractive.
Yes. I feel like it gives people more of a satisfaction that we're getting more to like the root of it rather than just kind of treating the symptoms.
Exactly. And that's number two for me, that the patients feel like the treatments I'm offering are just a Band-Aid, so to speak. They're not really getting to that root, as you say. They don't really understand. Because we don't understand the problem, we can't explain the problem. And because we can't explain the problem, we can't really treat the problem. We're just treating the symptoms. And then the third one, I think, is the perception of safety. And it's the truth that a lot of our medicines do have a ton of side effects. And of course, we have to disclose them. We know a lot about them. And compared to something where maybe you don't know much about it, I mean, it probably is generally safer to use herbs than some of our treatments, but it also may not be. We just don't know. So there's the real safety issue and then the perception of safety. But it is different, right? If you're listening to someone say, I want to put this thing on your child that has a warning on the prescription, on the box that says it can cause cancer. And then the other person saying, why don't we just try something like some shea butter? It's like, why don't we start with the shea butter?
Right. Yeah. It's so interesting, just kind of the psychology of it all. My personality is that I like something that has been rigorously studied and the safety has been documented, pro or con. At least it's like a relatively known entity. Whereas natural things always make me a little bit nervous because as a doctor, we don't have all those numbers for everything. There are a few things, so we're going to talk about those. But I think it's all about perception. For me, the unknown is scarier than the known. But I don't know.
And I've seen both. I've definitely had families who are nervous about stuff that you just don't know much about, and
Yeah.
they would prefer something that really has been rigorously tested. And I think
Yeah.
logically that makes sense. But
Yeah.
sometimes the devil that you know is actually scarier. You say, oh boy, this really does have a lot of scary stuff on there, and these side effects do seem concerning. So I'd rather try my luck. And I often talk about this paradox. We'll have patients who will pick something very much, measurably riskier than another
Yeah.
option, but it's
Yeah.
because of the perception. So I always say it's like the patient
Yes.
says, I don't fly in airplanes, they're too dangerous, and steps on their motorcycle without a helmet and rides away. And
Yes.
you're like,
Right.
wait a
Yeah.
minute.
Yes, yes. It's so true how we kind of all compute these things differently, these risks differently. Well, a few of the natural things that I have heard about, mostly from you and Dr. Raja Sivamani and some other people who have these focuses, I wanted to kind of go through that list and tell our audience a little bit more about each of these things, but also maybe correct me and how I'm thinking about them and explaining them to patients. So the first is olive oil. My impression is that this has been actually looked at for eczema and has been found to worsen the condition, disrupt the barrier more. What are your thoughts and feelings on that?
Yes, as an Italian American who
Yeah.
loves olive oil and pizza, eat it, enjoy it, absolutely cook with it, but it's probably not great on our skin. And I think that's right there. We don't have that much data. And I've heard people say, well, maybe it depends on the type of olive oil and the pressing. And it's possible. Certainly there's a lot
Mm,
of unknowns, but I agree with you. The data we do have suggests that it might actually damage the barrier and it may actually cause some inflammation. Plus, I've had a number of patients over the years where they put olive oil on their face and they actually get a seborrheic dermatitis outbreak. Sort of the story we tell, and I don't know if this is true, but it turns out when we grow the Malassezia
yeah.
yeast, right,
Yeah.
they use olive oil to grow it. It eats olive oil. So I often tell my patients, if you're putting it on your skin, it is possible that you're feeding into this and you don't want this yeast overgrowing on your skin.
That's so interesting, especially now Malassezia has become a little bit center stage in a lot of this stuff revolving around eczema and some of our systemic therapies, with Dupy and the head and neck eruption. Is that Malassezia related and all that kind of stuff? So that's very interesting that olive oil is food for Malassezia. I love
We
that.
eat it and they eat it, I guess, right?
Yeah, I mean, it's good, it's good for all of us to eat. It's tasty. Coconut oil. My understanding is that it's really neither pro nor con, that it doesn't seem to really help or really hurt, but that it can help with the flora in some ways.
Yes,
Tell
I'm
me.
definitely more bullish on coconut oil. Virgin coconut oil, the kind of cold pressed coconut oil, really seems to be pretty good for the skin barrier. It certainly doesn't damage it, apparently, that we see these comparisons. And it does, as you say, help the microbiome, the skin flora. There was this nice study out of the Philippines a number of years ago where they had a bunch of patients with atopic dermatitis who were colonized with Staphylococcus aureus, that bad staph bacteria that we don't want, that we think really drives the condition. And they had these people put on coconut oil twice daily for a month, and the control group put on olive oil twice daily for a month. And they found the coconut oil group cleared 95% of their staph aureus. So it really
Wow.
helped them. In the olive oil group, it had some improvement, but it sort of was hard to say what happened. But that I think is interesting. So right, by itself, it probably is not going to solve the whole problem, but I do often add coconut oil into part of my regimen for certain patients.
And a lot of times I'll tell people like coconut oil, if they like it, I'm cool with it,
Mm,
that sort of thing.
agreed.
Because a lot of people do like the coconut oil. Is there a difference? Is all coconut oil considered equal? You mentioned something about fine pressed. What should people be looking for on labels?
So, right. So, olive oil has all sorts of rules and restrictions. Like when they say something is extra virgin and all this kind of stuff, there's actually regulatory bodies who govern that. Like you can't make a false statement or else you get in trouble. Coconut oil doesn't have that. But in general, you're looking for something that is cold pressed, meaning they literally
Cold
just
pressed.
take the coconut meat and they squish it and they take that oil. Ideally, we don't really even want it refined or fractionated. Sometimes people will pick a fractionated one because that will stay liquid at room temperature, whereas the unfractionated one will be often solid at room temperature. But ideally, you get the whole oil and cold press. What is the alternative? Well, it turns out some ways to extract the coconut oil, the fats, is to use a solvent like hexane. And we don't really want them to use the solvent because there
Oh,
often is some trace solvent left behind. So ideally,
yes.
that's why you want cold pressed as opposed to something that's used a chemical pressing or a chemical extraction method.
Gotcha. Love it. Love it. And then black tea compresses. You taught me all about these for facial dermatitis, for facial eczema. Tell our audience about the miracle of black tea compresses.
and a miracle it really is, honestly, right? So apparently it's been used in Germany like time immemorial. Whenever I was actually in Germany not that long ago, a couple months ago, and I was telling them about this, and they were all rolling their eyes. They're like, "This is like what everybody's parents do," like it's just like
Yes.
this is a
Yeah.
home remedy, but
Yeah.
it really does help. And they did a beautiful formal study where they showed for patients with face and neck eczema, they had them do just a compress. So you basically make a cup of tea, and
Yeah.
ideally you'd use that second steeping. So you kind of drink the first cup or pitch it, and then use the same tea bag so it's a little bit weaker, and
Hmm.
then brew it up and then put that in the refrigerator, let it get nice and cool. Then throughout the day, you can just take a little washcloth or a soft gauze or tissue and gently dab it in there and place it on your skin to cool and soothe the skin, to make just a gentle cooling compress. And when you do this multiple times throughout the day, followed by a good moisturizer right after to
Hmm.
protect the skin, it
Hmm.
is dramatic. It helps with itch and inflammation and irritation, and it's
Interesting.
very, very safe.
Interesting. You sent me the handout, like the instruction sheet for it. We can put that along with this episode so that our audience can do the black tea compresses on their own. The way you describe it, have you ever tried it? Two conditions come to mind. Have you ever tried it for the head and neck dermatitis associated with dupilumab and other biologics? Or have you ever tried it for rosacea?
Yes, for the first one, for the head and neck dermatitis,
Okay.
for sure. And I think it can be soothing. It can help. I don't want to overpromise. It doesn't necessarily cure it or anything, but it can be very helpful. I have not tried it for rosacea, so that would be an interesting place to try it. Somebody who's having an acute
Right?
rosacea flare up. Yeah,
Well, and the fact that it's kind of cool, I don't know, that'd be kind of interesting to try. Yeah.
I like that.
How about CBD? What are your thoughts on CBD?
I'm very interested in it. And in fact, a number of years ago, I was advising for a company based out of Colorado that had a
Of course.
of course,
Anything
right?
CBD, yeah,
Yes,
comes from
that's where it
Colorado.
all
Yeah.
kind of
Yeah.
began.
Yeah.
They had a beautiful balm that had CBD in there. Now, we know that, of course, CBD comes from the hemp plant, which is the same plant as the marijuana plant, although it's different cultivars, right? So the marijuana one is rich in THC, the ingredient that's psychoactive that makes you high, and hemp should have very little, if any, THC, barely measurable. So it shouldn't make you high if you were to ingest it. And ideally, what we're looking for really is the cannabidiol. We want the CBD. We don't really want THC for the skin stuff. And this product was beautifully formulated, and a lot of my patients loved it. But because of federal regulations and stuff, it's actually quite difficult for these guys to do business. They have to use special banks. It's like weird. So the company went under.
Oh.
But I do think it's promising. And there's no doubt that CBD has potential for anti-itch,
Mhm.
anti-inflammatory. It seems to have an effect on our oil secretion. So there's a lot of cool stuff in pain. I think we
Yeah.
need to re-explore it. And now, from what I understand, they're signaling that they're going to open up the doors a little bit to this
Right.
federally, and that may help us.
I heard that maybe a change in the scheduling of these sorts of things so that more studies can be done. I totally agree with you that I'm curious about the potential benefit of CBD for inflammation, for itch relief. But if you just search for CBD cream on your Amazon app, you get this list of products, and so many of those products have so much other junk in it. It's just hard as a dermatologist to specifically recommend. It's just so hard.
Well, you bring up the most important point, and I feel like
Yeah.
maybe the theme of alternative medicine and integrative medicine is exactly that. It's like, even if you know an
Yeah.
ingredient, this
Yeah.
plant extract, this thing will help. This can help. Okay, that's great. That's step one. A lot of
Yeah.
times we don't even know. We don't even have good data. But when we do, that's only the beginning, because, right, then it's like, is it actually present in the product that you're looking at? Is it present in a high enough dose? Is it present consistently, batch to batch? Maybe they put it in
Yeah.
one batch and then the next batch doesn't have any. Is
Right.
it formulated in a setting that is actually going to allow for it to do its job and not cancel it out? Are there other things in there that are going to work again? So all of those pieces, right, all the way up. That's why if you say this, CBD helps or doesn't help, it's like, that's a big statement. Like,
Yeah.
we really need to look on a product to product level, because one
Yes.
product may irritate the heck out of somebody's skin, but another one might really help. And we have to understand why.
Yes, yes. And like even when you're looking for a product with one good active ingredient, you need to be cautious about what else is in there, which leads me to sunflower seed oil, which has been shown, my understanding, to provide benefit for patients with atopic dermatitis or eczema, but difficult to find a good preparation. And you turned me on to a place in Chicago called Aroma Workshop that makes a spray bottle of it, and they'll ship anywhere and you don't need a prescription. And so when patients are interested, that tends to be what I recommend. What are your additional thoughts about sunflower seed oil?
I'm a big fan of it topically.
Mhm.
Absolutely. It does seem to have some anti-inflammatory effect. It's got some ability to make our body make some more of the fats that are healthy, the ceramide fats in our skin barrier. Very gentle, well tolerated, and right. It's pretty inexpensive. You do
Yeah.
want to make sure you get a good grade of it. Make sure it doesn't have contaminants, things like that. So Aroma Workshop is great because they really work in these high level, very well sourced type of botanicals. So I
Yeah.
love a place like that. But food grade is also fine. I think the food
Oh,
grade ones are great because they also are rigorously tested.
yeah.
So that's great. And I think patients can use them. Again, it's not the whole story, but I'll often have patients use them. And in fact, we even have a special combination of coconut, sunflower together in a jojoba base that we love for babies because it kind of has both of those things that I like, and it stays liquid at room temperature because again, the coconut oil by itself will often freeze and it makes it hard to use because you're kind of scraping it out.
And is that a product you sell in your office, or Aroma Workshop makes that too?
They make it for us, yeah, and then we just buy it from them in small batches and just resell it so our patients can get it. We basically sell it at cost because we just want people to be able to have it.
That's great. And I don't know, just for our audience, when I recommend the sunflower seed oil spray from Aroma Workshop, I typically tell people it runs about $22 with I think $8 shipping, depending on where you live. Any idea about the cost of the sunflower seed coconut oil jojoba mix?
I think it's even less than that. I want to say it's
Is
like
it?
10 or $12 kind of thing. Yeah,
Okay.
plus
Okay.
shipping, it should be under 20 bucks.
Okay. That's really nice. I'm going to start telling folks about that. Now, those are kind of the 5 things that I will talk about in clinic with a family that is interested in kind of the natural realm. What am I missing? What else should I be telling people about?
I mean, those are great, and those are more than I feel like most dermatologists even even mess around with. The rabbit hole keeps going, right? It gets
Yeah.
deeper and deeper. I mean, I'll say one other thing that I'm interested in lately is there's a wonderful paper called Feeding Filaggrin, and it
Mhm.
came out a few years ago where they had this group of patients with eczema, and they actually gave them the supplement of L-Histidine.
I've heard
Right.
about this.
And
Yes.
this is weird. It's like L-histidine is just an amino acid, so like kind of a precursor to proteins. It's
Yeah.
real safe. It's just like a supplement. You can just get it. And they had these patients take more of it, just mix it in like their drink or a smoothie, and they found that they made more filaggrin in their skin, and their skin barrier got stronger because we know filaggrin is that important protein that helps with strength of our skin barrier, but it also acts as natural moisturizing factor and holds water in its place. It's really cool. So they had this group of people do it, and it really worked. So you can get filaggrin, and in fact, one of the companies that I'm an advisor for makes a kind of a custom version for babies. They have like little baby size packets. They
Oh
have
my
toddler gummies,
gosh.
and then for adults, they have a larger sachet that you can get that they've really done good quality control because you can get it. But again, same thing. You never know if you're getting a weird bulk
Yes.
brand. It's like, are you sure this is okay? Have they tested it? So someone's gone through the trouble to make sure something that you're going to take, especially for kids. I'm really picky about that.
Oh, of course, of course. This, Skincredible at the time of this recording is not sponsored by anybody in particular. We have no sponsorship. Nobody's sponsoring us. Nobody is supporting us. But
Not yet.
we're not yet, but we're doing it. Do you mind sharing the brand of that L-histidine with the baby and the toddler version?
For sure. It's called Codex Labs, Codex, Codex
Okay.
Labs. And I know, disclosure, I'm an advisor for them, and I get
Yeah.
to work with them on projects and stuff. And they're really great. But the founder, her name is Barb Paldis, and she is really incredible. She's kind of a genius, a polyglot. She is just one of these people that is truly motivated and dedicated to helping people. Like she never sits still. She's always in the mood. She's always working. She's always thinking about stuff. And I just love working with her. I'm like, you're one of the most inspiring people I know. You're
I
just
love
incredible.
that.
Yeah.
Oh my gosh, I want to meet her now too.
You would
And
love her. You guys you'll hit it off.
oh, you just used a word I didn't know, polyglot. Tell me, what does that mean,
She
Peter
speaks so
Leo?
many languages. I think she speaks like honestly like
Oh,
5 languages fluently. Like honest to goodness. I've heard her
wow.
flipping back and forth in different languages and like, yeah, unbelievable.
Wow. Oh, that's impressive. I wish when I was young, I learned like 12 languages because your brain is such a sponge for it when you're little. And then when you're old like me, it's not a sponge anymore. It's a hard surface in there.
Tell me about it. Lack of absorbency. Yes.
Speaking of L-histidine, I heard once that there's a little bit of L-histidine in dupilumab. Is that true? Like in the formulation as an ingredient? And when I asked the dupilumab people about it, they said it's not at a level where we're expecting it to be therapeutic in any way. I
Maybe
think it's like
pH
a
buffer or
maybe,
something.
yeah. But I just wondered if you had heard that too.
That's cool. I did not hear that, but that is really neat. So
Yeah.
that's how safe it is. You can even inject it.
Right. Yeah. And then the other thing that I hear about all day, every day. And I bet you know what I'm about to say. 2 words, Peter Leo: beef
Beef tallow.
tallow. Tell me your thoughts. I mean, to me, it basically just seems like a version of petrolatum that is just derived from beef processing as opposed to oil refining. But it's like a thick, yeah.
Yeah.
Tell me your
We
thoughts.
wrote a little piece that it hasn't come out yet, but kind of talking about unconventional moisturizers. So we actually
Yes.
that's the inspiration for this, because so many of my patients, our patients, they keep bringing it up. I don't think it's bad. I think that the biggest problem with it is that it probably, because it's mostly just fats, that it really fits into what you would call more of an emollient rather than a full moisturizer that has other components. So I think by itself, it'll soften the skin, it'll add some good fats. It feels good, it's just greasy,
Mhm.
and then you smell like French fries, like
Yeah.
McDonald's French fries, which
Yeah.
is, I don't know, it's not appealing to me. When
Right.
somebody's using it, as soon as they walk by me, I'm like, beef
Yes.
tallow. Yep. But I think it's pretty safe. My only fear, just theoretically, is I just worry a little bit, especially in babies, putting on beef products like this
Yeah.
on their skin, because I worry about things like mad cow disease. I think the risk is
Right.
very, very low, but I don't
Yeah.
exactly know how they get this. And there may be nervous tissue,
Right.
central nervous tissue in there, brain tissue and spinal cord. And what
Yeah.
if? I just don't know. It just makes me a little bit nervous to slather in the fat of an animal, even though I realize it is in some ways more natural than some of the other things we do. But it kind of just weirds me out a little bit. But I
Yeah.
think it's probably okay.
Yeah. Yeah. And then I have heard you talk about your love of France and this particular place in France that delivers this exceptional, do we call it hydrotherapy or balneotherapy?
Yeah, both, right? Exactly.
Okay.
So hydrotherapy, just water therapy, and
Yeah.
balneo is just for bath, so bathing therapy. Both are really used. And what's so cool about France is that their like health system, their national health system will actually pay for patients to get this therapy if you have bad eczema, bad psoriasis, if you're on a chemotherapy drug treating a cancer and have a bad skin reaction, all these
Wow.
kinds of things, certain genetic skin diseases. You can spend 3 weeks per year at one of the centers. There's actually over 100 of these hydrotherapy centers or balneotherapy centers in France. Some of the big ones we've all heard in the States because they make products that feature their water. So a big one is La Roche-Posay. La Roche-Posay is
Yes.
one. The other one is called Aven. That's a big one.
Yes.
Vichy is another one. And it turns out
Oh,
even
yes.
Avion has one. And Avion, I think, is less medical. It's a little bit more spa-like. But the
Yeah.
other ones they feel like a hospital. I mean, you go in there and it's a day treatment center. You don't stay in the hospital there. But
Okay.
usually people will come to that part of France. They'll rent a little place or an apartment. There are hotels too, but I think a lot of people do like an Airbnb type thing. They come in the day, they soak in the water, they get sprayed with the water, they kind of spray them down. They do wet wrap therapy. There are dermatologists on staff too, so it's quite serious. And
Yeah.
and then you drink a lot of the water. And I've sent a number of patients over the years, which
Yeah.
has been incredible. And I've had them go, and some of them I get to meet at the end. So they have 3 weeks, then I'll meet them for the last few days, and it's incredible. It can really turn everything
Oh.
around. So yeah, I love it, and I'm obsessed with it.
What do they think is special about the water? Like, could we do this in Boise, Idaho?
So okay, I love that. So that is what I want to work on as for my next trick. I really
Yeah.
want to see if we can bring some of this back to the US. Like,
Yeah.
obviously we can't all go to France. I wish we all
Right.
could and hang
Oh,
out,
that'd be
but
great. Yes.
could we do some regional centers, and could we even do some stuff at home? So one thing I've done, so I'll take you all the way to the one side, is doing a home treatment. And I have a little thing on our Chicago Eczema Center website where I call it home spa therapy. And it's like you can kind of take what they're doing home, because it turns out most of the companies I mentioned, they sell their water. You can actually buy their eau thermal, their mineral or thermal waters in a can, and you can spritz it on your skin. So you're getting the water, and then you
Wow.
could put a moisturizer over it. And in fact, that's basically what they're doing. So you can use, one of they all have them. So they have their waters and they have their different moisturizers. And if you do that throughout the day, you can approximate it. But I would love to do something at a more regional area. So like a center in Boise where you'd be able to recapitulate it. So, right. So each center has their own little story about what makes them special. So some of them talk
Oh.
about the mineral content. They'll say, we have a high level of selenium, and that's anti-inflammatory and anti-itch. Others will talk about the fact that they have certain bacteria, good probiotics in the water that are
Oh.
helping. And it's probably some combination of all that. Plus, you're in a really relaxing place and people are taking care of you. Plus, they're moisturizing and doing wet wraps on your skin, which we know makes a huge difference. Plus, you're eating better. You've broken out of your cycles of life. I mean, right? There's a whole bunch of complexity around this. It's obviously not just the water. I wish it were that simple, but there is more to it. But I can tell you that it can be dramatic and transformative. I had a little girl, they would come in from Michigan to see me, and we did everything, and I ran out of ideas. And La Roche-Posay sent me a message, said, do you have a severe patient you'd like to bring? I said, I have just the patient.
Yes.
Her and her mom, and they went, and that one, I didn't go visit them, but they came back home, and I mean, it changed her life. It changed the trajectory of her life. She was able to go back to school. She was on like a 504 plan, could work from home, do school from home because she was so severe. She was able to go back to school. I still see her, and she's doing amazingly now. I mean, now she's a teenager, right? This was years ago.
That's amazing. And you showed me pictures of this part of France where I feel relaxed just looking at those pictures. So I imagine the stress relief of going to such a beautiful place. I bet that plays a part in it too.
Huge.
It's a little bit of everything. Yeah. You mentioned probiotics, that maybe there are some species of bacteria in this water that help in an anti-inflammatory way and in a probiotic kind of way. My understanding of probiotics when it comes to eczema is that if a pregnant woman takes them during the pregnancy and after delivery, it can reduce eczema in a baby. But if you already have eczema and you take probiotics, it doesn't seem to help. Am I wrong? Set me right, Peter Leo.
No, you're, as usual, you're right on. And I think the weirdest thing for me and the most exciting thing for me is that there are so many rapid changes happening in this area that it's been kind of mind blowing. And I remember 20 years ago talking about, we were like, why can't we just take one of the oral probiotic pills and just mix it into a cream? Like, why not? Well, now we know, because to some degree, I think, and in a few years, we're going to look back and say, gosh, do you remember when we just talked about probiotics as one concept? Like, do probiotics help? We're going to look back, I think, and say, boy, that sounds as goofy as saying, do antibiotics help for an infection?
Right.
Say, well, of course. And if I said to you, well, I had a patient with an infection and I gave them penicillin and it didn't help. And you'd say, well, wait a minute, what kind of an infection? You have to get the right antibiotic and the right infection. So you can't pick a random antibiotic. All antibiotics don't help with all infections. It doesn't make any sense, right?
Yes.
You could even get more specific. We need to know the dosing and right? But here we are with probiotics. We just lump them together. Somebody takes a probiotic pill or spritzes something on their skin. It's like, well, I guess probiotics don't help. It's like, wait a minute, like that particular thing didn't help, but we can't throw out the baby with the bathwater. So yes, I think the big one is Lactobacillus rhamnosus GG is this particular strain that's been studied and has pretty convincing data that if it doesn't prevent atopic dermatitis, it at least delays it. So for pregnant moms, and then if the baby starts taking it right when they come out, it seems to at least push it off, which is great. So that's but absolutely right. If you give Lactobacillus rhamnosus GG to people with eczema, it just didn't seem to ever bubble up beyond chance that it's helping them. So for that, then there's different combinations and different strains that seem to help. And the most compelling work, the author's last name is Wang, W-A-N-G, first initials are I-J. That paper is spectacular, where they did this study of a mixture of probiotics, and there are different lactobacillus strains in there. I think Salivarius and Paracasei are in the main study, but there are some other ones. And when you look there, you actually can find a signal. So what I'm interested in is trying to find better, more refined combinations that I think may affect more people broadly until we can get more personalized medicine where I can say, the strains that will help you in particular will be this combination or this one. But I think getting mixtures may help us do more broadly. And then some of the strains that have the best data orally, but then topically, a whole universe there. And I'll tell you again, I'm conflicted because I'm an advisor for a company, but they don't have a product, so there's nothing to buy.
Yeah.
They're working on it, but they're a company based in Cambridge, Massachusetts. They're called Concerto Biosciences. And they have developed a technology to look at interactions between bacteria. And they've done tens of millions of combinations. And they've come up with a group of 3 little buddies, 3 probiotics that seem to work together to help get rid of Staph aureus on our skin when it's sprayed on there. And they're actually trying to take that through the FDA as a drug. So
oh my gosh,
incredibly exciting to see how much science. The best would be at a meeting. They'd be like, so what do you think about this? What do you know about this? I'm like, wait, you guys, you are at the limit of science. You are literally pushing stuff forward. Like nobody knows. There's no knowledge in this area. You are, it's a pitch black forest. And you have the lantern. You're going in there, and they're pushing everything forward. And it has just been so sobering and exciting to see how complex it is too. All the different interactions and understanding who will play well together. It's incredible.
I love that. And so what I'm hearing is that I'm going to have to start knowing all these long names of different probiotic species. That's what I'm hearing. I'm going to have to be able to pronounce them. I'm going to have to be able to spell them.
Hopefully just in the meantime, then if somebody hits it, gets the right combo for us, then we'll just be able to call it, we'll have one name to remember. This is the combo you need. Do that one.
Yes. Oh, man. Kind of thinking about, affecting the flora and kind of somewhat natural. I've become a real big fan recently of hypochlorous acid, which has been around forever. A lot of people called it bleach bath in a bottle for years and years. But I think there's something there with hypochlorous acid. Do you recommend that much to your patients?
I do. And
Yeah.
I think it's doing a few things. I love the spray. I think a spray
Yes,
action
me
is
too.
so cooling and soothing. And then we know
Yes.
that the stabilized hypochlorous is probably better than a dilute bleach bath, because I think the dilute bleach baths aren't quite strong enough to kill bacteria, but these might be because they sit on the skin longer.
Yeah.
Yeah, patients love them. I'm with you. There's a bunch of good brands. Tower 28 has one. Skin Smart on Amazon is another one that I've
Yes.
gotten. Of course, there's even cleansers that have them too, like that CLN wash that's been around for quite some time.
Yeah, I really like, there's one meant for eyelids called AcuSoft hypochlorous acid spray. And I think anything meant for eyelids is going to be nice for sensitive skin. And so I've become a fan of that one too. But I've used the Skin Smart one also. That one's pretty nice as well. Now, are there any natural things that you would tell people, like, don't use it? Like, there are side effects that we know about and we shouldn't be using it. Are there any that have that warning from you where you're like, don't do it?
I mean, there are a lot of things. I think, in terms of topical botanicals for eczema, tea tree oil is probably generally not a good fit. It can be irritating. It has some good ideas like, oh, it's antibacterial, shouldn't we use it? But it seems to cause more trouble than it's worth. I think that a lot of the big things that I counsel around are dietary modification. So many people feel that, food and diet is playing a huge role. And for some, it really is. But it turns out that for the average eczema patient, or for most eczema patients, it's actually probably a smaller role. So I try not to spend too much time and energy on it. But I've had families go all the way and like actually get hurt, and people get into trouble. They cut their diet so severely, now they're not growing, and now they're not getting protein. So you can get into big trouble. Plus, I really try to counsel around this idea that we want to eat lots of foods to get that tolerance, right? We know that, well, the way I like to say it is Ruchi Gupta, who's a pediatrician here in Chicago and great food allergy researcher. She's a wonderful author. She came up with this great quote that I tell all my patients, and I have like a little sign, and it's, through the skin, allergies begin. Through the
I
diet,
love that.
they stay quiet. Through the skin, they begin. Through the diet, they stay quiet. And we know this is the idea. So we want to heal the skin barrier because we don't want broken, damaged, open skin. That's how we're getting these allergens in, at least some of them. And then we want to keep the diet to keep them quiet, because that's how we become tolerant to them. We tell our body, hey, this is food, not an allergy. Calm down and take it. But if we skip those things, if we avoid them, then there's actually a real risk that we can become allergic to them. And there's a whole literature on this. Anne Marie Singh is a wonderful allergist up in Wisconsin, right? She wrote that paper. Patients thought, well, maybe it's this particular food causing my eczema. I'm just going to cut it out, which we used to say, okay. But then when they added it back later, so if they decide, okay, it wasn't that food, I still have eczema, they added the food back. Now they actually really are allergic to it. Now they're getting hives. It's like, oh my gosh, we've made our worst nightmare become a reality.
She taught me that. I did a talk with her, Dr. Anne Marie Singh. She's in Madison, Wisconsin. She's lovely. She's an allergist. And I did a talk with her, and she taught me that if you do have kind of diet-driven eczema and you strictly avoid that food, you increase the chance of having a IgE-related allergy to that food. And we definitely don't want that. So she still encourages her patients to have little bits of the dietary product that's causing a little bit of eczema to keep it in their diet, which is so interesting. What about lavender? I've heard reports of gynecomastia, which basically, for the audience, that means developing breast buds with the use of lavender. How do you feel about lavender? Do you care about lavender? What do you think?
Yeah, I mean, lavender is interesting. Probably for our purposes, it doesn't do much of what I'm interested in on the skin. It certainly smells wonderful. It can help people, sleep well. It is present in one of the concoctions we make for alopecia areata, but it's at a fairly small level.
Yeah.
It's true. There were the case series about that those boys were having breast development with it. Now, those are funny series, though, because I think in all of the ones, they were mixtures. They had lavender, but they also had tea tree. And there were some other issues around it. They were also using very purified essential oil. One of the hard parts too is like an essential oil is different than something like cold pressed coconut oil. When it's essential oil, they actually are doing a distillation process. It's extremely concentrated. It's a very unnatural thing, frankly. So in general, we do not want to put undiluted essential oils on our skin. So the things that I'm recommending are things where we're actually mixing them in carrier oils or mixing them with other things so they're diluted, but an undiluted essential oil on your skin, not only can it be extremely irritating, you might be absorbing some of the different compounds that could cause trouble later. I mean, botanicals are active, right? They have lots of chemicals, and you're putting it into your body in a very abnormal way that our ancestors really wouldn't have been able to do, distill it down over and over and over.
Yeah. Yeah. Well, that's really helpful. I find also sometimes if a patient of mine really wants to try some naturally derived thing, I'll have them do a use test on their upper inner arm or their child's upper inner arm, just to kind of assess tolerability. These are eczema patients. They're more sensitive to begin with. And so sometimes they'll say, okay, if you want to try that, try a little bit, in a place where a rash would kind of hide and kind of suss it out that way first. Do you ever do that if there's something that they want to try?
Absolutely. I think that is the best advice. Absolutely.
Yeah. Yeah. Well, wonderful, Dr. Leo. Now, in our closing moments, I wanted to talk a little bit about topical steroid withdrawal because I know you've published a lot on it. And I know that it's a big reason why I think we're seeing so much interest in the naturally derived therapies. I think a lot of people are afraid of topical corticosteroids. And in the previous episodes of the Skincredible podcast, we talked about all of the non-steroid options that have emerged. Hi, Nix, your cute little doggy.
It literally never fails. It never fails.
It's okay. We're dog lovers here. And so I wanted your feelings and your input on topical steroid withdrawal. What should listeners understand about the condition?
Okay, so topical steroid withdrawal is one of those very controversial topics that I wish it weren't, because we know it causes a huge amount of suffering in our patients and is one of those things where it is kind of stressing the relationship between patient and clinician.
Yes.
So I worry about it a lot, and I worry about my patients who are suffering because they're miserable, their skin is terrible, their life is impacted, and then they're like, and nobody believes me. People are calling me crazy. I'm like, this is the worst of all worlds. But I do think that there is something to it. And we just published in the last week here in the British Journal of Dermatology, a consensus statement from a number of dermatologists. We used a Delphi process, and we have some diagnostic considerations for it. And I think that's going to help move this whole discussion forward. This is a real entity. It is actually acknowledged by the UK Health Ministry and also Canada Health. It's actually on topical steroids now. So even if you're skeptical or don't believe it, I think the cat's out of the bag. There are government regulatory bodies who are now talking about it. We've been working to develop an ICD-10 code so we can properly code it and study it, because it's this chicken and the egg thing. They're like, well, we don't really know about it yet. It's like, well, the only way we're going to know about it is, we have to be able to code it, because otherwise people just, we don't know how to do that. But we are moving forward. And I think that it really is, to me, the single most important piece is that there's an escalating need for corticosteroids, that people are doing fine at a low level, and then they keep needing more and more and more, and they're kind of hooked on them. And then when you stop, they get much, much worse. And then we're in big, big trouble. So this is the piece that I think is the only thing that counts, even if you don't believe in it, even if you think that it's silly or made up or an internet phenomenon, which I assure you it's not. But even if you think that, if we listen to our patients who say, listen, I've used a ton of steroids and I'm really doing really badly, I don't want to keep using steroids. The beauty is we now have a huge armamentarium of non-steroidal treatments. So that's all I'm saying. And I think that's why a lot of people that I respect and admire who maybe are more skeptical about this, I think in part is because they naturally avoid using steroids too much, so they don't see it in their own patients, right? You say, okay, this is not a good fit. You're using too much triamcinolone. We're going to switch you out. We're going to use dupilumab or phototherapy or whatever else it is. And those patients are spared. But the patients who don't get spared are the ones who eventually overuse and get into trouble.
Yes. And so you kind of alluded to this, but for the audience, risk factors for developing corticosteroid withdrawal syndrome.
I think the most important one is the historical pattern. I think that's the one that's the most sensitive, the most one we can really sink our teeth into, where you have an escalating need for them. So here's the textbook, right? We all know that it should be for a milder patient or somebody. It's like, I had a little eczema flare. I used my cortisone, hydrocortisone 2.5%, Desanide, triamcinolone, whatever it is. I used it for a few days. It got better. And then I put the tube away, and I've been good for a while. And then I had maybe a few weeks later, another little flare up here. That's pretty safe. I feel like most people could probably do that on and off for the rest of their life, and it wouldn't really matter. it may not be the optimal treatment, but it's pretty safe. Now, here's where I get worried. I used it. It did help. I used it for 14 days and then I stopped. And actually on day 2, it was right back. So I used it another 14 days and now I'm here at my month follow-up, a few days after the month. And I've been basically using it all the time. That's bad. Or it's not even helping anymore. Can you give me something a little bit stronger? And then they go up to the next level, up to the next level. You'll see that pattern. To me, that's the most important thing. And then there's all these specific signs and symptoms that they see. Patients, once they have it, in this point, that's why I'm focusing on that part, because I think you can catch it before it becomes a thing. Once it's a thing, they have this sign called the sleeve sign, where they have often like confluent redness up until their wrists and their ankles. They have this elephant skin, which is sort of a lax skin appearance that's very strange. They can have this, the patients often refer to as snow, where there's tons of exfoliation and dry skin and flaking, that we would call it an exfoliative erythroderma pattern, where they're just really shedding everywhere. And then of course, there's these things called zingers, the patients call it, which is like a paresthesia. They get like stinging sensations, burning. It's all these pieces. So it is a really interesting and strange and frankly terrible condition for these patients.
Yeah, the burning and stinging, that's been kind of the hallmark to me. Not that eczema can't burn and sting, but it seems almost different. I had one patient, a teenage girl, who had been prescribed 2 medicines by her primary care doctor. One to use for a rash on her leg, one to use on her face for something different. And she accidentally mixed them up and had been using a super potent topical steroid on her face for like 3 or 4 months before the mistake was realized. And so then, of course, she stopped, and then she got this horrible corticosteroid withdrawal syndrome. But with our topical non-steroidals, we were able to get it under control really, really quickly for her. So there is therapy out there for these people who are suffering. Yeah.
Absolutely.
And if you're seeing a dermatology clinician that isn't helping you, see somebody else. Like, there are enough of us out there that we can help. Don't go on suffering. We can help. Yeah.
I 100% agree. That's the truth. And unfortunately, you have to advocate for yourself sometimes in every aspect of life, including in your healthcare.
Yes. Definitely. Well, thank you so much, Peter Leo. This was so kind of you to be a guest on our new pod, Skincredible. You are a wealth of information. I have learned so much from you over the years. I'm proud to now call you a friend, and I appreciate you so much doing this with us.
Oh, Dr. Swanson, my pleasure and honor to be on here. I hope I get to do this again with you in the future, and I will definitely see you in person at some point soon.
Yes, maybe in France.
Yes, ideally.
We can meet up at that place.
I love it.
Thanks, Peter Leo.